Good morning and welcome to today's session on health talks for general public. Basically, what we are doing from the Parkinson Disease and Movement Disorders Clinic is that on a monthly basis, we are having a small interesting talks which will be useful for all the patients with Parkinson disease, and not only that, with people with various aging related disorders could be of useful. Today, in this context, we are having uh, Anjana Prasad, who is a speech pathologist and Deglutonologist, working at MVM College of Technical College, where she is the one of the teaching consultants and professor at the department. She'll be talking about the process of swallowing, what are the issues, and what are the tips and tricks to manage the swallowing issues. Anjana, welcome to the session. It will be very nice to listen from you, and all the podium is for yours to talk about that.
Thank you, sir. Good morning, all. I hope you all are doing good. Okay. So for today's session, let me just share the slide and we shall start with it. Okay. So shall we begin?
Yes, please go ahead.
Okay. So the topic for today is a common swallowing issues or the swallowing difficulties which are facing in individuals with Parkinson disease. And also individuals with older adults, like as you get aged, what are the small difficulties that you can face or issues that you can see when you try to eat your food or when you try to swallow easily, right? So before we begin, let's see what's Parkinson disease. I'm sure majority of you are like very much aware about it, like about the Parkinson disease. And let me discuss it with you in a very simple way. Right? For example, there are different type of chemical substances in our brain, right? Which has to work coordinately for us to have all the movements and for our daily things to go smoothly. So the same way in a car, right now I'm sitting in a car because there's a little bit of sound outside. For example, in a car, if there's no good enough oil is not done, like good oiling has not happened, what will happen when you try to drive? When you try to drive, it won't be smooth enough. There can be a lot of jerk, different movements, like no smooth brakes. When you want to stop, you're not able to give a proper control over it, right? So there will be uncontrolled movements that can happen and which doesn't make the movement of the car smooth. The same way, there is a substance called as dopamine in your brain, which is very important for your movements, to control your movements, to make it a smooth movement, right? So when that decreases, the reduction of the dopamine that happens in your brain, you can there will be difficulties such as shaking, stiffness. You can when you're trying to grasp grapes, or when you're trying to take a remote, you might struggle there. Daily living, right? When you want to change a channel, there will be a little bit of shaking. You're not able to change it smoothly. Or for example, when you try to grab grapes, right? You might find it difficult to pluck it out, right? Or try to move a chair. Or also you can feel a lot of imbalance or feel like you're going to fall. That like fear to get up and walk, all those things. So these movements, movements are uncoordinated over there. The same way, like for example, imagine you have taken the grapes and you have put it in your mouth. What's the next thing you have to do? You have to chew it well, then you have to try to swallow it. Imagine the same, this muscles in your hand as well as your body are weak and it's uncoordinated. Same way that you have good enough muscles in your mouth, So those muscles are also uncoordinated, right? Those muscles are also affected. So I like the same way when your tongue keeps moving or your lips keep moving, are you sure you'll be able to have a smooth chewing, smooth swallow? You might struggle there. Issues that you're facing when it comes to swallowing a food or when you try to attempt to drink any liquid or may say water, right? So I hope you all had a good breakfast. If not, I have a picture for you, right? So the first thing when you see the picture, what's that come to your head? Like, what's the first thing that happens? Like it's a big thali with lot of food. You'll start to salivate, right? So right after you salivate, what's the next thing you do? You smell. Try hard when you try to smell, right? Right after you smell, what happens? Grab a bite, put it in your mouth. Let me show you what happens right after you put it in the mouth. All the normal procedure, how you chew and how you try to swallow. I'll show you through a video. Okay, before that, let's imagine it's not a case that we all will do, but imagine we have taken a bite, we have put it in your mouth. It's still there. You're not swallowing it purposefully. It's an assumption. It's not a scenario where we try to do because all of us would want to swallow as soon as we get the food. Like eat it, fill your tummy, right? So imagine you're not swallowing, be it water or food. What happens? The food is still in the mouth or per se it's not going inside your body. So what are the things that can happen if the food doesn't go? Can someone tell me? Okay, so what happens when we try, like when the food doesn't go, is like lack of nutrients. All the nutrients in the food we didn't get it. Malnutrition over the time. Per se, for 3-4 days, there's nothing you're not swallowing. Weight loss, dehydration, right? And the entire body functioning is totally affected. And at the end of the, it will really affect your mood. You might get irritated for simple things, fights in the home, simple misunderstandings, simple talks, irritations, right? So it's very necessary to swallow. So it's very important because it will really affect your malnutrition, dehydration happens, weight loss. These are the things that I have told. So that shows how important for you to swallow your food, smoothly swallow your food is. So now you have grabbed a bite. Let me show you what happens right after that. If I'm going fast or if anyone wants me to repeat it again, feel free to let me know, right? Either you can tell it or you can just put it up in the chat box. Okay. Now you have grabbed the food. ಊಟನ ಬಾಯಿ ಒಳಗಡೆ ಇಟ್ಟಿದ್ದೀನಿ. ಊಟ ಇಟ್ಟಾದ್ಮೇಲೆ ಫಸ್ಟ್ ವಾಟ್ ಡು ವಿ ಡು? ಅಗಿಬೇಕು. ಚೆನ್ನಾಗಿ ಅಗಿದ್ದು ಅದನ್ನ ಪೀಸ್ ಪೀಸ್ ಮಾಡ್ಬೇಕಲ್ಲ. ಅಗಿದ್ದು ಎಸ್. ಎಸ್. ಅಗಿದ್ದು ಅದನ್ನ ಪೀಸ್ ಪೀಸ್ ಮಾಡ್ತೀವಿ. What are we using? Here, let me tell you the structures inside. We have the tongue. This is a roof. Here's your teeth. Here's a lip. Am I pointing it? Are you able to see the pointing? Okay. Here is a tongue.
Yes.
Yes. Here is a roof of your mouth. Here you can see these two things is a teeth. Here all your jaw has to move. So when you try to chew your food, your tongue, the main structures which function, your tongue and your jaw, it has to move coordinately. If there's weakness or stiffness there, you can find. Just a second, I saw. Yeah, I'll get back to you with the like I saw somebody has a question we have asked here. So I'll get back to you right after this. So here, with the tongue and as well as a jaw, you move it and you try to break the food with the support of it, right? Once you break the food, there's a procedure which we all follow. Even me, before I studied this, I did not know that. I was not, we don't consciously do that process. That is called, ಈ ಊಟನ ಎಲ್ಲ ಸೇರಿ ಉಂಡೆ ತರ ಮಾಡ್ತೀವಿ ನಾವು. The first important thing which we use to make it is the saliva. Using the saliva in the mouth and with the help of our tongue and the jaw, we do this and we make the ball, like a ball shape, like one unde tara we make the food into. Okay. So that is a procedure which we all do, but we are not consciously doing it. We're not, and suddenly we put really effort. Next time when you chew, grab a bite, and when you're trying to chew, you can observe that. It's not like you're just chewing and salivating, like swallowing. You make it as a ball or try to grab everything together. The first thing is required for this saliva. Saliva will moisten the food. Why it is necessary to moisten the food? Because if the food is really rough or we are not moist, imagine there's no water, nothing in the mouth, it's just chewing and swallowing. If the food is rough, once it's go to your throat, there are thin muscles there, right? So the small tissue, imagine in between the hand, if you keep some rough thing and rub it, because when you're moving the food down through the throat, that rubbing happens with the muscles in the throat. So there can be cracks or some, this thing happen to your muscles there, for your skin there, right? That's very necessary. Enough saliva and the movements to make the food as a ball kind. Let me show you. It's called as a bolus, we say. You can see it's chewed. See the tongue and the jaw equally moving for it. Now you have made the bolus. That unde kind of thing is called the bolus that we all make using the saliva and the tongue before we push the food back. Once we make that, what happens? We have to push the food back for the swallow, for us to swallow the food. The tongue will raise from the front and at the back it will bend and you will push the food. I will show you here. Another important thing which we do, we have a pipe connected here. This is a structure here you can see. It can move at the end. So from here, all this area is your nasal cavity or your nose. So the same breath, it will go inside, right? So once you try to move the food, what happens? This structure particularly will raise up and close your nasal cavity so that ಊಟ ಮೂಗಿಂದ ಬರಬಾರ್ದು ಆಚೆ ಅಂತ ಆಯ್ತಾ. ಅದನ್ನ ಪ್ರಾಪರ್ ಆಗಿ ಕ್ಲೋಸ್ ಆಗಿಲ್ಲ ಅಂದ್ರೆ there is situations where you tend to get the food from the nose. Okay. And now when you, before you push the food, let me show you here. You can see two pipes, right? One pipe is for your food. ಊಟ ಮಾಡಕ್ಕಿರೋದು ಒಂದು, ಇನ್ನೊಂದು ಉಸಿರಾಡಕ್ಕಂದಿರೋದು. Like for you to take the breath and for the food, it both happens through the same passage. But here there's a division. ಉಸಿರು ತಗೊಂಡು ಒಂದು ಈ ಕಡೆಯಿಂದ ಈ ಪೈಪಿಗೆ ಹೋಗ್ಬೇಕು, ಊಟನ ಈ ಪೈಪಿಗೆ ಹೋಗ್ಬೇಕು, ರೈಟ್? ಸೊ ಊಟ ಮಾಡ್ಬೇಕಾದ್ರೆ ಈ ಪೈಪ್ ಓಪನ್ ಆಗಿದ್ರೆ what happens? Your food will go to that pipe, right? Imagine it's staying like this and you're trying to push the food. The food is coming back. This pipe is also open. In that situation, what happens? Your food goes to windpipe, the pipe for the breathing. ಉಸಿರಾಡಕ್ಕಂದಿರೋದು ಪೈಪಲ್ಲಿ. That has a connection to your lung. ಊಟ ಕಡೆ ಹೋದ್ರೆ ಕೆಂಬರದು ಸಡನ್ ಆಗಿ, aspirations, ನೇತತ್ತದು, it will go to lungs and over the time, if it gets accumulated, pneumonia, that's a further cause of it. And some emergency situations, fatal situations either, right? So it's very necessary. You should not talk while we eat. That's what everyone says. We still didn't think why. This is a cause. Because when you're talking, you need to breathe. This is open. This is open when you need to breathe. Right? So when you're trying to talk as well as eat together, this one structure poor thing, it doesn't know where to close, what to close. Such situations, your food is going to this pipe, right? Okay. So it's raised up, like how I said, closing the nasal cavity. Now the food is going to be pushed down. So while pushing, you can look at the red structure which I showed you here. Now it will bend down and close the windpipe. See, it's closing the windpipe. So you can have a safe swallow, right? And there are structures over here in the throat, which will also move coordinately for you to swallow your food smoothly. Okay. This is one. So once the food goes to your food pipe, there happens a, like, let me show you. Somebody has asked me what is peristalsis. It's a wave-like movement, like this kind of movement, which happens in the tube here. The tube has to function properly and have a smooth movement. That movement, the wave-like movement is called as peristalsis. So here in the tube, that movement has to happen smoothly, and then it will go to your stomach or your intestine for the further digestion, right? We have told about importance of swallowing. Okay, let me ask you. So these are the procedure how you swallow. So if in any of your experiencing any difficulties in any of the procedure here, what all can it be? Can any one of you tell it? What all do you think are the problems that can be seen in this whole procedure? Because I explained you in the Parkinson's disease, what are the thing that you can see with the muscle structures, uncontrolled movement, sometimes stiffness, in other cases, weakness. So with all these things, what are the difficulties, the swallowing or the while you chew? What are the difficulties you see?
ಅವ್ರ ಬಾಯಿ ತೆಗ್ದು ನುಂಗಲ್ಲ, ಬಾಯಿ ಮುಚ್ಕೊಂಡೇ ಅಗಿತಾ ಇರ್ತಾರೆ. ಅದಕ್ಕೆ ಏನ್ ಮಾಡ್ಬೇಕು?
ಬಾಯಿ ಇನ್ನೊಂದ್ಸರಿ ಹೇಳ್ತೀರಾ?
ಬಾಯಿ ಕ್ಲೋಸ್ ಮಾಡ್ಕೊಂಡೇ ಅಗಿತಾ ಇರ್ತಾರೆ.
ಓಕೆ.
ಓಪನ್ ಮಾಡಲ್ಲ, ಬಾಯಿ ಓಪನ್ ಮಾಡಲ್ಲ.
ಓಪನ್ ಮಾಡಲ್ಲ. ಓಕೆ. ಒನ್ ಥಿಂಗ್ ಈಸ್ ಬಾಯಿ ಕ್ಲೋಸ್, ನಾವು ಯಾವಾಗ್ಲೂ ಊಟ ತಗೋಬೇಕಾದ್ರೆ ಬಾಯಿ ಓಪನ್ ಮಾಡಿ ತಗೊಂಡ್ ಆಮೇಲೆ ಹಿಂಗ ಅಗಿಬೋದು, ಬಾಯಿ ಕ್ಲೋಸ್ ಮಾಡ್ಬಿಟ್ಟು ಅಗಿಬೋದು. ದಟ್ ಇಸ್ ನಾಟ್ ಅನ್ ಇಶ್ಯೂ, ರೈಟ್? ಬಟ್ ಅಗಿದು ಇಫ್ ಯು ನಾಟ್ ಏಬಲ್ ಟು ಸ್ವಾಲೋ, ನುಂಗ್ತಿಲ್ಲ, ಬಾಯಿ ಒಳಗಡೆನೆ ಊಟ ಇಟ್ಟಿರ್ತೀವಿ, ರೈಟ್?
ನುಂಗಿದ್ನ ವಾಪಸ್ ಬರುತ್ತೆ, ನುಂಗ್ಬಿಡ್ತಾರೆ, ತಿರ್ಗಾ ತೆಗಿತಾರೆ.
ಬಿಕಾಸ್ ಹೋಗ್ತಿಲ್ಲ ಅಂತ ಅಲ್ವಾ?
ಒಂದು ಸ್ವಲ್ಪ ಹೊತ್ತು ಹಾಗೆ ಮಾಡ್ತಾರೆ, ಆಮೇಲೆ ನುಂಗಿ ಸುಮಾರು ಹೊತ್ತು 2-3 ನಿಮಿಷ ಅಗಿತಾನೇ ಇರ್ತಾರೆ. ನೀರ್ ಆಗೋಗಿರುತ್ತೆ, ಆದ್ರೂ ಅದು ನುಂಗ್ತಾರೆ ಮತ್ತೆ ತೆಗಿತಾರೆ.
ಓಕೆ, this is one of the issue. Ma'am, I'll come at the end. One issue, what can be done, aita? So this is one of the issue. Very good. And after that, in any other issues, can you all, any of you list it? One issue, you are chewing, but you're not able to you are not able to start the swallow. Other issues? Anyone? Yes, you tend to cough. Another issue. Yes. Tell me some other issues. If not, I'll go for the next slide where we can discuss the issues. Okay, so I'll go. Okay. The first thing, when I showed you the food, what is the first thing we all have to, like, imagine the food in front of you, you smell it, right? Then you keep it in the mouth, you understand the taste. In some situations, not all, not majority, in very few situations, there's a loss of taste and smell that you can experience, right? ಅದಾಮೇಲೆ ಊಟ ಅಗಿಬೇಕು ಚೆನ್ನಾಗಿ, ನಾಲಿಗೆದು ಮತ್ತೆ ಜಾದು ಸಪೋರ್ಟ್ ತಗೊಂಡು, ಅವಾಗ ಅದಕ್ಕೆಲ್ಲ ಅದರಲ್ಲಿ ವೀಕ್ನೆಸ್ಸು, ಇನ್ ಸಮ್ ಕೇಸಸ್ ಜಾ ಮೂಮೆಂಟ್ ವಿಲ್ ಬಿ ರೆಸ್ಟ್ರಿಕ್ಟೆಡ್. ಆ ಟೈಮಲ್ಲಿ ಏನಾಗುತ್ತಂದ್ರೆ ಅಗಿಯಕ್ಕೆ ಕಷ್ಟ ಇರುತ್ತೆ, ಡಿಫಿಕಲ್ಟಿ ಇನ್ ಚೂಯಿಂಗ್. ಅದಾದ್ಮೇಲೆ ನಾನು ಹೇಳಿದ್ರಲ್ಲ ಉಂಡೆ ತರ ಮಾಡ್ಬೇಕಂತ, ಆ ಉಂಡೆ ಮಾಡಕ್ಕೆ ಸಲೈವ ಇನಫ್ ಇರಬೇಕು, ನಾಲಿಗೆ ಕರೆಕ್ಟ್ ಆಗಿ ಮೂವ್ ಆಗ್ಬೇಕು. ದಟ್ ಡಸಂಟ್ ಹ್ಯಾಪನ್, difficulty forming the bolus. The bolus is the unde, to be much more specified. And some situations you can see, they would have the same way lips also has muscles, right? The muscles has to work properly for it to close whenever necessary and whenever to open. So you're trying to close. The muscles has to work. Some situations, it stays like this. Muscles doesn't help you to close, right? In such situation, spillage, ota bile kotruno, it will keep going. If not food, you can see drooling, salivana ache barta irodu, right? Spillage of the food or water from the mouth, or drooling you can see. Another one, the one like ma'am has mentioned now, difficulty initiating to swallow. ಬಾಯಲ್ಲೇಟು ಆಗಿದ್ದು ಬಟ್ ನುಂಗ್ತಿಲ್ಲ, ಆಚೆ ಬರ್ತಾ ಇದೆ ಇಲ್ಲ, it's staying there. Why? Because they have difficult. Okay, before I tell this, let me ask you, do you think when we sleep we swallow? ಇಷ್ಟೆಲ್ಲ ಪ್ರೊಸೀಜರ್ ಮಾಡಿ ನಮ್ ಸಲೈವನ do we swallow when we sleep? Or we don't swallow, it's just we're sleeping, we're not voluntarily doing anything, we're not swallowing. Does that happen? Like, do you think we swallow?
ಐ ಥಿಂಕ್ ಭಾಳ ಮಾಡಿ ಸಾಲ್ವ್ ಮಾಡ್ತೇವೆ ನಾವು, ಯಾಕೆ ರಾತ್ರಿ ಇಲ್ಲ ಬಾಯಲ್ಲಿ ಜ್ವಲ್ ಬರುತ್ತೆ ಮಕ್ಕಳಿಗೆ, ವಯಸ್ಸಾದಲ್ಲಿ ಜ್ವಲ್ ಬರುತ್ತೆ, ಸೊ
Yes.
ಸಾಲ್ವ್ ಮಾಡ್ತಾ ಇರ್ತೇವೆ ಅನ್ಸುತ್ತೆ.
Yes. So when we're sleeping, we swallow, which shows that it is also an involuntary movement, which happens because of the reflexes. Because we are not knowing that we're swallowing, it's happening involuntarily. So half of the procedure is involuntarily that happens because of the reflex. Chewing, all that voluntarily we have to do. But at the end of the day, nungbekandre, the reflexes has to happen. So at younger ages, we all would have done this, or any ages, we try to put the hand in the mouth and try to get a gag and try to vomit. What happens when you put the like hand there? There's a sensation you can feel. It's a reflex. One reflex called as gag. Similar way, there's another reflex, their reflexes for swallowing. The same area, when the muscles are not functioning properly, those muscles should have the reflexes. Our reflexes correct ಆಗಿ ಇರಲಿಲ್ಲ ಅಂದ್ರೆ ಊಟ ಇನಿಷಿಯೇಟ್ ಮಾಡೋದು, ನುಂಗಕ್ಕೆ ಇನಿಷಿಯೇಟ್ ಮಾಡಕ್ಕೆ there is a difficulty. So the same way when ma'am had mentioned now, ಬಾಯಲ್ಲಿ it stays there, but it doesn't go inside because the reflex na ಅಲ್ಲಿ affect ಆಗಿರುತ್ತೆ. ನುಂಗ್ಬೇಕಂದ್ರೆ ಫಸ್ಟ್ ರಿಫ್ಲೆಕ್ಸ್ ಆಕ್ಟಿವೇಟ್ ಆಗಬೇಕು ಊಟ ಹಿಂದಕ್ಕೆ ಹೋದಾಗ. Okay, difficulty initiating to swallow, we say. Next one, I told you about two pipe. When it goes to the wind pipe, that's ಉಸಿರಾಡಕ್ಕೆ ಇರೋ pipe ಅಲ್ಲಿ ಹೋದ್ರೆ risk of aspiration ನೇತತ್ತದು, right? Another one, I said here the throat also, it has to move smoothly. So sensation of the food stuck over there. And also trouble clearing food from your mouth. At the end of the day, after you chew, if you feel, you can see there'll be a lot of food remaining in your mouth. Maybe here, we have to do all this and we have to grab the food and put right. So when you have weakness in your tongue, not able to lift it up properly, how can you grab all this with the tongue? Can you do that? It's like this. How can you move it to both sides and take it properly and get it back? So trouble clearing the food from the mouth once you're done eating. These are the common issues that is seen. Okay. Okay. Now these are the issues. But how can you say like you're having these issues? There has to have a signs and symptoms for it. Like, for example, for you to tell that you are having sinusitis or cold inside, you need to sneeze. You sneeze and runny nose. It's a sign that, okay, there is sinus, something happened, or headache. The sign that sinus is happening. It's you getting it, right? Sorry. So there, for you to say that aspiration happens, difficulty chewing, all these things, what are the signs? How can you say that? In most of the cases, you don't understand it's a difficulty or it's a normal thing. It gets unidentified. The first and foremost sign is a prolonged meal duration. Compare it with a normal individual has to finish the food if you're eating in a normal pace, 20 minutes, 20 to 30 minutes. For example, if you have the habit, the same individual had the habit of finishing food very fast. See if it's the same or that meal duration is prolonged. Imagine in 20 minutes if they've extended to 40 minutes. It's a prolongation. Even 5 minutes extra is also prolonged, right? Prolonged meal ಡ್ಯೂರೇಷನ್. ಒಂದು ಊಟನ ಮುಗ್ಸಕ್ಕೆ ಅವರು ಎಷ್ಟು ಟೈಮ್ ತಗೋತಿದ್ರಂದ್ರೆ, ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ಒಬ್ರು 15 ಮಿನಿಟ್ಸ್ ತಗೋತಾರೆ. It ate very fast, normally, before. After the disease or after these difficulties they see, over the time it has become 35-40 minutes. Is that normal? ಸೇಮ್ ಪರ್ಸನ್, ಅದೇ ಇಂಡಿವಿಜುವಲ್ನ ಮುಂಚೆ 15 ಮಿನಿಟ್ಸ್ 20 ನಿಮಿಷದಲ್ಲಿ ಊಟ ಮುಗಿಸುತ್ತಿದ್ರು. ಆ ಸೇಮ್ ಇಂಡಿವಿಜುವಲ್ನ 40 ಮಿನಿಟ್ಸ್ ತಗೋತಿದ್ದಾರೆ. We may not notice it sometimes, but that's a main indication that because all the processes are getting delayed, the prolongation of the meal duration happens. First and foremost thing. Next thing, I said risk of aspiration. How do you know you're getting aspiration? In rarest of the rare case, a silent aspiration happens. But as soon as you take the food, how do you know, like, are you aspirating the food or you're having a safe swallow? Cough. ಉಸಿರು like ಕಿಟ್ಕೊಳ್ಳೋ ತರ, choking. When you're trying to swallow, ಇಲ್ಲೆಲ್ಲ ಚೆನ್ನಾಗಾಗಿದ್ದು ನುಂಗ್ಬೇಕಾದ್ರೆ ತಕ್ಷಣ ಕೆಮ್ಮದು, choke ಆಗೋದು. Shows that aspiration, you're trying, there's a risk of aspiration that's happening. ಊಟ ಆ ಕಡೆ ಹೋದಾಗಲೇ ಕೆಮ್ಮಿ, it is taking it out. So it shows that it's going inside, which means that it's not covered properly. The muscle is affected there, right? Another thing, voice change. Mamuli, for example, I'm talking. My name is Anjana. Anjana. You can hear a little bit of watery sound in the throat, right? It's not clear. Now it's clear. I've swallowed. I'd kept my saliva here. It's wet. You could hear some gurgly sound, or from before, after the person finished the meal, you can see a little bit of change in the voice. Right? It's an indication that it's not swallowed completely. The food is still there. Even if the person is not understanding, as a person who listens to it or as a caretaker, you can understand that. Change in the voice, another sign. Okay. These are the signs and symptoms and the issues we have discussed. So let's see how that is impacting your life. If you have these issues, what is the end of the day? What is happening? It's impacting your daily life or daily procedures or yourself. First thing, helplessness. The person who could eat whatever food they want, how much of a fast, or was independently doing, suddenly has to depend or change the food or not able to eat the favorite food. There's a lot of helplessness that happen. Anxiety, the mood, they feel really helpless, like the mood and everything is get affected there. Another thing, social interaction. Lack of, when you have it drooling or you feel that inferior, socially inferior, that okay, how can I go sit in front of someone where I have drooling? But that's not an issue at all, because you have to think of yourself at the end of the day. If other person cannot deal with it, their thing. Let them, they have to deal. If they have issue, let them, they find a way. But you will always have that inferiority, like you'll always think, what if I go there? What if I attend this function? What if all these things happens? Will the other person, my friend or some social people, other gathered people, will they be okay? You pull yourself from the social interactions, like pull yourself inside. Stop attending parties. You tend to do all that. Stop attending weddings or other functions where there's a lot of gathering that happens. But I would say, no, attend. Right? Your thing, your identity, you have to maintain it. Others don't, if you thinking that if they have issue, their thing, none of your issue. If you're comfortable enough, or if you need a support and somebody is really supporting you from the family or within your close group, if to take you there, feel free, be good to attend. No issues with that. Another thing, nutritional status, right? Because when you're eating, how the food is going out, or if you're not able to comfortably swallow all the food, there's a lack of minerals and all the supplements needed for the food not getting in. Lack of nutrition, right? So these are the ways when you're not able to swallow, or when you're facing all these issues, how that is going to impact your life. Because at the end of the day, it's your life. So you have to see how things are impacting. Then you can take action for it, right? So I've spoke all this about it. Let's see what can we do for it. Managements and treatments. For any of the issue, we do have a management or a solution for it, right? So the first thing you can do, for example, if you're difficult, you're not able to chew, hard for normal roti, you are eating properly, not able to chew. Or if you're not able to chew the rice, make it as a paste, right? Put it in a grinder, mix it up with a little bit of water or like anything. Mix it up, and then you can eat it. It just become a thick paste now. You don't have to chew, because at the end of the day, you should get the supplements or the minerals necessary. Just because you're not able to chew on that, and because of same reason, if you're not able to swallow, you're lacking all your minerals, right? To deal. So then, for example, you're not able to bite the apple. Apple is quite crunchy. You have to bite it and chew. Add some milk. Make it as a paste. The taste is same again, right? Scoop it up. Eat it. So you can smoothly, so you don't have to chew there, right? Few such modifications with your food habits you can do over there. Even with the water. In another case is like you get choking when you tend to swallow. I'll tell you what can be done for that, right? One thing, difficulty swallowing. And some people, they can chew, but then they're not able to chew very hard food, like the chapati, which is dry. You're not able to chew because maybe no enough saliva production to make it moist. What is it? Keep the chewing good. In the chapati, add some milk. What happens? The chapati become soft. Make the food soft. Okay. Keep it in your mouth. Chew. You'll feel it much more easier to chew. In situations where you can chew a little bit, but you need a help. Make the food soft. Other cases, you're not able to chew at all or chew a little bit. Same thing can be done. Make the food a paste. You can have it. And make sure you add extra supplements, protein powders, everything to it, so that you're getting all the supplements without lacking any of it, very importantly, right? Over the time, there are exercises which we'll teach you, which we can teach you, like when you consult an SLP or a swallow therapist, they'll teach you which you can help the muscles strengthen over the time. But at the same time, you cannot stop eating. So these are the modifications in your diet you can do. But always consult an SLP or the speech language or a swallow therapist. They'll tell you exercises, what can be done to strengthen your all the muscles required for the procedure. And we do have a lot of maneuvers, we say, to help the swallowing smoother. It will vary from individual to individual. So one such, not a maneuver, it's a positional thing for the safe swallow. I'll show it to you. What happens when you get choking, right? And other cases when one of them I mentioned, they're not able to swallow it. The reflexes are weak. We have to strengthen it. We can teach you exercises as well as a way where you can strengthen those, so that each individual can consult and where you can find it or which area if it's affected. So once it's affected, we'll give you methods where you can swallow, make it easier for you to swallow. So now you understood where it is affected there, right? You have to find a way to swallow it. Another thing, when you get choking, first thing, if I ask you to, if you can all grab a glass of water, right? I've got a jug of water. So maybe we can do a demonstration. The first thing, once you grab a glass of water. Okay, another thing. Do you all have the habit of drinking water in the bottle or a glass? Anyone?
Bottle.
Bottle. So whenever you try to drink the water through the bottle, what happens the first thing? We all have the habit of lifting your head up and pouring it out, like how it is seen in the first picture. Do you think that's okay?
No.
Yes, it's not. Because here what happens? When you do this, there's an easy way for the food to go to your windpipe. The structure which I showed you before, it's easily opened, right? So that is why in all the case, like for example, sometimes you tell that, okay, when we drink in a fast way, it doesn't happen, ma'am. What is it? It doesn't have to happen, but the risk is there always, right? There's always a risk factor for the normal individuals. When you're having a smooth swallow, if you tend to do this also, for them also there's a risk. No drinking like this. When you have, especially when you have weakness, not at all. See the second picture. Is it boy? He's drinking. Hach kudibeku. Glass in that. It's always preferably pour it to a glass. Preferably a small glass where you can refill it again and again. Chick glass alli. Solpa haki. It's not like you have to drink less amount of water. Enough amount of water is very necessary. But drink slowly. Pour little bit. Kach kudibeku. Kachi. Take it like this. Okay, I have a big glass here. So Kachi. I didn't do this. I did. I bit it. And you have to drink. Right? That is the one. So if you can all take it, I'll show you a safe swallow technique which you can do to prevent yourself from choking or getting aspirated when you try to swallow water or the food or anything. If you all can grab a glass of water, that would be fine. Glass of water, preferably a small glass of water. Keep another bottle of water nearby. Pour it to the glass. Okay. Let me explain you how you have to do first. Then we can do it together. Will that be okay?
Yes.
Okay. So see the third picture there. First, the person's chin is like this. You can see the chin straight, right? Next thing, chin has come down, right? So when you try to, now we are going to drink a water. So put your chin straight, drink the water. After that, put your chin, push it down. Try to touch the chest, right? Or just push it down. You can see here the muscle, the structure like this. Preferably put it like this, right? Can we do that? I will just show it once. I'm going to sip a little bit of water here. My chin, my head, my neck is straight. Neck is straight. I took a water. Then I'm going to put the chin towards your chest in the starting of your chest here. And swallow. Then finish the swallow. Lift it up. No talking in between. First and foremost thing. No talking. Right? So can we try this?
Yes.
Yes. Grab a glass of water. Drink it. If anybody is there with you to support, just remind them from the head like this. One sip of water would be fine. Right? I hope it's done. Okay. So this is the way when you get choking, if there are when the people experiencing like excessive coughing or choking when you try to swallow, this one technique you can use when you try to eat. Follow this. I wouldn't say that always your chin has to be like this when you start eating itself, because all of the food might come out. Keep the chin straight. If you're able to chew properly, keep the food in the mouth. Chew. Then put it down like this. Then swallow. While swallowing, let the chin come here. If in cases, if you want like for them to have a sensation here that the chin has to stay down, keep a towel or a hanky, anything here. Ask them to hold it, easy way. Because they will also get a reminder that, okay, I have to hold it, keep in this position. So give the food in the mouth, ask them to chew, keep this here. the easiest thing you can find. Let them hold it with the chin and swallow. Once you finish swallowing, complete swallow, ask them to swallow once more. Then lift it up. Take it up. So this, once you keep it here, they'll also know, okay, I have to hold it. So that automatically the posture will come to that positions necessary, right? Another thing, when you're doing this, when you're feeding them, do not talk. We all have this habit right after we give the food, right after they put it in the mouth. For example, the wife, they've given to the husband, or the husband has prepared something really nice. Either ways, you give it to your spouse or your kids or your parents. Once they put it in the mouth, next thing, you ask, is it good? How is it? Does it taste nice? At that time, some cases you can see that the person is going to cough instead of giving you an answer. So there's another complaint. Nanota ಎಷ್ಟು ಚೆನ್ನಾಗಿ ಊಟ ಮಾಡಿದ್ರು ಕೇಳಿದಾಗ ಬರೀ ಕೆಮ್ತಾ ಇರ್ತಾರೆ. It's not that they're coughing. It's like they're trying to answer to you. That moment, the pipe is getting open there. The food is going there. Right? So that's why they're trying to cough or trying to feel that choking thing. It's not because they do not like the food or food was not good. So one good thing, give the food. I know I would not say not to ask, because it's at the end of the day, you should understand if they understood, if they like the food or whatever it is. Let them finish the food completely. And once you're done, once you're relaxed, ask them how was the food instead of talking in between. Another thing, people have the habit of watching TV and eating. What happens when you watch a TV? Half of your concentration is there. Sudden, maybe a good serial. Somebody sitting with you. Oh, this has happened. What is happening here? You tend to talk. The person who is eating tend to talk. Right? And they preferably keep all the surrounding very calm and less distracted. And when they're trying to eat also, try not to have a group chat or talk other side. Right? Try not to have all that. Because that's all taking their attention. They tend to talk, they tend to be not attended. Sometimes when they're chewing, the food is there. Because the concentration went somewhere, they're not finishing it up. It's still there. The next procedure is not happening. So many causes like that is there. And I'll give you a small tip for the family members, apart from whatever I just said, for the caregivers. So people, if they're taking a long time to finish the meal, instead of having a 3 meal, give them a 5 meal with less amount each time. Okay. So such a way it's not like, oh, excuse me. So it's not like the breakfast, they're not taking this much hour. Instead, cut the meal. They should not get frustrated or relaxed or irritated that, okay, I'm not able to finish this completely. Cut short, give a little bit in the starting. Give them a break, later the food. So instead of having 3 times a meal, give them breaks in between and make the meal more frequent than having long meal at a time. Okay, and keep, like how you said, keep the environment relaxed. Another thing, all these issues which I've mentioned and the signs and symptoms, always keep an observation on them. That are they experiencing any of it? Little bit. So in such situation, always feel free to consult your doctor or your therapist or your swallow therapist or speech therapist. Feel free to discuss with them what are the issues that's being faced. Okay. So this way we can all help them have a safe swallow, as well as to find out the problems and help provide them exercises and maneuvers to make a smooth swallow. Okay. So that's it. We can have a discussion now. I guess I took a longer time. I'm sorry, like if I took a it's a Sunday. Yeah, so I understand.
Good. I think, thank you. Thanks a lot, Anjan. This was very good, slow, nice explanation. I think we should have even had in person some of the people to actively participate. I think that would have been very great for us to understand those things. There are a few questions.
Yeah.
What we can do is you can stop sharing the screen. I'll ask the questions, then that will be more easier. And if anyone else wants to ask questions, they can also join and ask the questions as such. Good. Thank you. Thanks once again. Nice explanation about how the swallowing happens. Nungar henge, yav tara jagitevi, yav tara nungtevi, ಏನಾಗುತ್ತೆ ಅನ್ನೋದು. And what are the smaller intricacies associated, what we can do on day-to-day practice. ಡೈಲಿ ಏನು ಮಾಡ್ಬೋದು, ನಾವು ಹೆಂಗೆ ಮ್ಯಾನೇಜ್ ಮಾಡ್ಬೋದು ಅನ್ನೋದನ್ನು ಎಕ್ಸ್ಪ್ಲೇನ್ ಮಾಡಿದ್ರೆ, and what are the issues what we notice and how to manage them. That's a nicely covered sessions. Okay,
Thank you.
I'll go one by one questions which are there here in the chat box. Then anyone want to ask spontaneously, they can raise their hands or they can ask the questions impromptu also. One Mr. Sabreen Banu has asked, what does peristalsis means? What do you mean by that?
Yes, peristalsis, I guess while I was explaining that procedure through the video, I saw the question. I tried to explain it there because it's a movement. So once you put the food goes to your what to say, the food pipe, that happens a wave-like motion. Food has to move smoothly, right? So through that pipe, so that esophagus, the pipe there, and goes under unless reaches the intestine, that movement happens. So that movement is called as a peristalsis movement. It doesn't have with the swallow here, but the video had it. But this is a movement that goes first.
The peristalsis is basically wave-like of contractions which
Yes.
helps to move the fruit from the
Yes.
mouth to the stomach, right?
Yeah. Basically from not from the food pipe, and once it reaches a food pipe, from there to the intestine. Because until there, it's the swallowing that we are doing.
So after the mouth part, when it reaches the esophagus, what we call it as,
Yes.
from there to stomach. Excellent.
Yeah.
Good. I think that should be clear enough. Okay. Next question is, in some families, while eating food, they tell that not to drink any water. In between, don't keep on drinking water. Just finish the food. You drink water at the end of the food. Is that a right practice or a good practice?
Yes. It's same even you have a difficulty or not. That's a good practice which I myself follow. I've seen a people who have the habit that grab a food, drink a glass of water, right? So that practice, it's for the body. It's nothing related to swallow as such. It is not helping your body. You're lacking a lot of nutrients over there. And again, like you're moistening the food with the water, where you can moisten using a saliva either, right? So, but in situations in patients or individuals where you're having a difficulty to push it back or to moisten it, you can add a little bit of water. Or before that only, you can add to the food a little bit of water, make it smooth to avoid all these things in between. So it's always better to finish the meal and have a good water. In between, if you're feeling like there's a choking or something, one important thing I would want to say is, I just remembered now, it's not related to this, but can I just tell it?
Sure, please go ahead.
Yes. So it's like I said that you can experience a choking or coughing. So then I just showed you the technique which you can follow for that. But in cases when that if any of this work you're not able to follow it or anything, and the person is coughing excessively and there's a it shows that aspiration is happening. It's happening. So such cases, what you can do, cough as a person to cough at the maximum possible. So cough is a reflex that gets the food out from that pipe. Cough and pat. We all, as an older level, as a kid, we all have the habit, like our adults used to tell us, there's a lizard upstairs. Look up when you try to choke, right? Look up. No, that's the wrong thing we can do. Look up or hit on your head. That doesn't help anything. And doing this, not at all helping. It's creating problem. Instead, that ask them to put down, and another thing, ask them to cough at the maximum possible. And pat on their back instead of patting on their head. This is a way you can do. Okay. I used the habit of looking up, or I used to tell to the people. Once I learned it, once we got to know the mechanism, it's like, okay, not up. It's never up. It's always down. And the cough hardly is a thing. And drinking water, yeah, it's better to drink at the end of it, or moisten or soften the food in the starting itself and provide it to them. In between, if they need water, it's necessary. If they're finding it difficult, you can always drink.
In the same context, because lot of families, if you remember, we tell that kach kudibadi, yet kudiri neeru anta helteve. Is it because whatever I heard here, it looks to be a wrong way of doing it?
Yes.
Is it only from hygienic perspective why people tell that, or is that having a different level? Means person who has exercised more can do like that, and if you're able to do that, means your swallowing is good or something like that. What does that mean? Is it a good practice, or what is the interpretation of that?
Yeah. So like how you said, it's not a good practice at all. Because what happens when you try to lift, people tell that because like when you're sharing a glass or when you're trying to share your bottle, because enjal agbardu anta. But instead have a glass for yourself and kach kudibeko. When you try to bite and drink, whatever happens is your thing. You can do that, right? So it's always good to carry a glass when you travel because of the same reason. Because you have habit. Everyone has all of us have a habit of drinking water from the bottle, which is like lifting the head up and drinking. Right. So instead of that, it's always better if you're having difficulties or if you're the slow, better to carry your own bottles. And for people, they will be finding it difficult to drink. Or you can always have a straw, glass with a straw. If you're not able to kach kudiye kashta idre, put a straw, pull it up and drink. Solve for yourself. But no, never put your head up and drink. That's always a bad practice. Wrong practice.
Okay, thank you. Next question. Does having excessive salivation an issue for eating food? Because we tell, especially in Parkinson disease or some other disorders, people drool, right? So if you have a little bit more salivation, is it a problem or is it okay? Because even though sometimes people are not complaining, we as a caregiver, we are worried about that. They are drooling, ಊಟ ಮಾಡಕ್ಕೆ ಜ್ವಲ್ ಬರ್ತಾ ಇರ್ತದೆ ಸುಮ್ಮನೆ ಕೂತ್ಕೊಂಡಾಗ ಅದಕ್ಕೆ ಊಟ ಮಾಡಕ್ ಆಗಲ್ಲ ಅಂತ ನಾವು ಯೋಚನೆ ಮಾಡ್ತಿರ್ತೇವೆ. So what is the scientific perception for this?
Yes. So why we have excessive salivation? Why do we have more saliva in the mouth? It's because the salivary glands. So the muscles here, which is equally responsible for saliva production, that's not coordinately working. So some cases people might have complaint of having less saliva in the mouth. Other cases because the glands are working reduced. The reduction of the working that is happening. Other cases, it's not coordinately working. That case is excessive production that happens. Okay. That it will affect yourself. You feel uncomfortable. It's not like it's affecting your swallow or the food production. One thing it will affect is because you'll drool. Right. So we do have exercises for that which can help you reduce your saliva production. Basically, your muscles are being weak. It's getting wasted, like the muscles there. So when you if you keep the mouth like this without talking or moving for a long time, you can obviously see a lot of saliva production accumulating. So we have exercises to activate it or to coordinate it, which can decrease excessive saliva production. It doesn't affect with the swallowing, like any of the choking or any of the thing, but you have you yourself is feeling struggle there to swallow it like multiple times, or along with the food when you intake it, there's a good enough amount of saliva is needed, required to it. So as an individual, normally normal individual will have a production of say, 0.5 liters to 1.5 liter. So for them, the production might be like little more. So excessive saliva, like when you put the food, it can drool. As a caretaker or as for them, they might find difficulty while eating.
Excellent. Thank you. Thanks a lot. The next question is by Mr. Manoharan, who asks, how many years all these swallowing symptoms will develop for Parkinson's patient? And is it dependent upon patient to patient? And is there any exercises to prolong or avoid this or postpone this, to ask?
Yes. So yeah, the first thing you might all face, or when you consult the doctor, maybe when they've come to your doctor with a complaint of imbalance, right? No, there rare cases they would have come to you telling that I have difficulty swallowing. Even though at some point maybe the swallowing is getting delayed, you may not notice it. Some cases it's going unnoticed. Even if you're having choking sometimes, you think that maybe it's just not normal thing. So the first and foremost thing would be the other issues, but along with that, swallowing is also happening, and it will vary from individual to individual. So we cannot say exactly for one particular case this can happen. Some cases that might be speech will be delayed first, right? In such cases, swallowing also will be delayed equally. Some cases when they have the gait issue, they have walking difficulty, but they're able to talk and everything. For such cases, this swallowing might be okay. But over the time, you can see a like delay, difficulty to move completely, chew, because the muscles here are working. So same muscles are required for the swallowing. So it varies from individual to individual.
I think Anjana's connection got disconnected. Okay. So basically, I'll answer to Manoharan's question here. The swallowing issues varies based upon the type of Parkinsonian symptoms you are having or type of Parkinson diagnosis you are having. Normally, if it is Parkinson's disease, people will take sufficiently long time to develop swallowing issues. With some other type of Parkinsonian disorders, people can develop swallowing issues slightly earlier, like PSP patients or multiple system atrophy patients may have swallowing issues earlier. Yes, exercises, proper swallowing therapies will help to postpone. Many times we recommend everyone from day one. Usually for the first consultation or second or third, we tell that please speak to a speech therapist or a swallowing therapist, understand simple tricks of practicing what has to be done. And those things can be followed up on regular basis to maintain that. So that helps us in a long-term management of patients with Parkinsonian or even aging-related disorders. Swallowing issues can be managed without much problems as such. Okay.
I'm so sorry. There was a little bit of interruption between because my laptop, the charge went off. So I'm just joining back from the phone. Okay. Yeah. So as I was saying,
Yeah. We'll go to the next question. I think just we're covering it up there. Okay.
okay, that'll be fine.
Excuse me, sir.
Yes, sir. Please, sir. Go ahead. Can you
So
introduce yourself and ask the question?
yeah, it's correct. But there is a personal trainer or a specialist for this kind of who can come home and train the exercise.
Yes, I think that is what you are seeing here. Dr. Anjana Prasad is the speech therapist and deglutition specialist. So people who come and train for swallowing are called as speech pathologists, those who specialize in speech training, swallowing training, and they are not very commonly seen species. Means you don't see them everywhere. Okay, you need to go in search of them. So if you can find someone near your house, if they are ready to come, very good. But usually encourage them to go and meet in person, because I think there are very few speech pathologists and deglutition specialists, even like a city like Bangalore. So it is required. There are specialized trained people who can manage this type of things. Is that clear?
Thank you, sir. Thank you. Thank you.
Thank you. Thanks a lot. Okay. Now, going to the next question. So now what happens is when we cannot swallow normally and the tube is put, like for some people, we put tube is put and we give liquid food or ganji type of a food, we put it there. Is it good for body? Does it take care of body requirements? Means how long can we maintain that? Many times we have that question. Is that right? Is it doing good, bad, or how is it?
Yes. So why do we put the tube first and when do we put? So when do we put is suddenly you're having a lot of choking, you're not able to eat at all. The exercises, everything will take some time for you to show, right? For example, at least a little bit of time it will take for you to show that result. So at that time, you should not miss out on any of your supplements for your body, if your nutrient content for your body. In such situations, doctors always we recommend, and we as a SLP, cell therapist also we recommend for the NG tube, for the temporary thing, unless until the muscles get activated back and you get back to the flow, because you should not miss your nutrients, and it's okay to put it for that time. Later, along with the swallow therapy, everything, once you're back, once we can tell you that you are able to safe swallow, you can remove, we'll ask you to, we'll get it removed. So it's necessary somewhere, but it's better it's better to take therapy and let get it done with easier. Because it's anyways a thing in the nose, you will be disturbed with it, because those are factors which is commonly been there with the patients who have the tube.
Next question is once again by Mr. Manoharan. Any equipment to help with eating, drinking, or swallowing? Is there any equipment like that?
Okay, any equipment. So one of the equipment which I said is a straw.
Okay.
Right. So because you're not able to with the lip, you're not able to put it inside. So with a straw, it's a small occluded thing. Like it's like this, you can put it inside. So one of the thing would be that. And other thing, we do have like stimulations here, like which you can give the electrophysiological stimulations. But again, it's not to support swallow. It's all to stimulate the muscles. Okay. There's no equipment which you can prevent the choking or any of it. So it's all with the exercises and the electric. Apart from the exercises, this is the one thing which you use it to give the stimulation.
So you don't have any machines like you keep it on the throat or something like that, like speech people use, right? Some to produce some sounds. Here we don't have any machines which
Yes,
help.
that is the case when the vocal fold during the surgical cases. So that we use for the sound production. So here we don't have something where you keep it and you can swallow immediately. We do have things where you can use it for the electrical stimulation to stimulate the muscles. After time, the muscles will get stimulated and you can swallow, but not to keep it and immediately drink it without the stimulation or the exercise. It is their electrical equipments, but to stimulate the muscles, which will help the muscle activation.
Good, thank you. So basically, it means that at this point of time, we don't have any specific external equipment.
Like keep it and then swallow, it's not there.
Okay.
We do have electrical things where you can keep and stimulate it, and which is for the stimulation of the muscles basically.
Is it available in India and how much it may cost?
It is, but there are only specified people who where you can get it done from. So it might cost from the apart from that you can have the therapy. So apart from that it will cost you like maybe it will vary from the traders again.
Right. So it is made to measure for
It's not available very often also, like how you can see in any of the places. So you have to find a place where you get that done.
Okay, fine.
But apart from that, the other option we do is the therapy, like the stimulation, the therapy exercises.
And
Because along with it, that also has to be done.
so can we feed someone in sleeping position? A lot of, let us say, with aging, people become fragile. They can't sit. It's very difficult to feed them. Most of the time, they are sleeping, and we feel comfortable to feed them there in the sleeping position. Is it right? Is it wrong? Or we don't have any option? What can we do about that?
Okay. Feeding them in the sleeping position is not a good choice, I would say. But I understand, like most of the time they would be sleeping. Even we have this habit of drinking in something when you're trying to watch something sleeping, which is not a good habit. So it's always better if you can just give them a support from the back and at least make them sit for a while, then feed it. Let them sit for 5 minutes extra after they feed, before they sleep, get back to that posture again. So it's better not to. And as an older person, I understand like even all these difficulties which I just explained, it's seen in older adults also. But the frequency or the severity or the age, like over the time only it might be seen, like not, and it is not necessary for all the individual it will be seen. Some may not have the difficulty too. And some people you can see that taste preferences has changed, their meal time just getting prolonged 80 plus 75 plus 70 plus. So these are all because of the age things, factors that happen.
What simple home-based exercise, like normally we tell for people with aging, regular exercises, stretching, we ask them. What I can understand with normal aging also, your voice becomes slow, your swallowing process also becomes slow. Is there something what we can practice on a daily basis, even though I have Parkinson or even if I don't have it, I can maintain my swallowing muscles or swallowing activity better? What type of simple exercise, like take home, let us say I want to go, like, even though I don't have, I want to practice it on a regular basis, like few minutes of exercise. Is there anything like that, or there is nothing like that?
Okay, so one thing which I showed was a chin being down, which is to help people from the aspiration or choking. Apart from that, if you're difficulty chewing, we do have exercises which can stimulate the muscles in the oral cavity. For example, the tongue, which is a main important factor, the jaw, the lip to close it. So these exercises you can follow to strengthen. For example, you have the habit of lifting or doing small exercises for your legs and for your hands. Same way, there are few exercises which you can do to keep the muscles, the strength of the muscles maintained. For example, if I want to list out few, let's say, let's keep for example, like we all do squat position. Like we stay in the squat position, we maintain for some time. It's for the thighs, for the calf, right? Same way, take your tongue out. Without the support, hold it for 5 seconds. You can feel a little bit of pain over the tongue also, right? Same way you do for the other body parts. Put it inside. Both the side. Try to reach, hold in each position, roll it up, and try producing the words like ka, ta, okay, for some time. So these are all helping with your tongue muscles over there. Simple few things. And with the lips, as I'm just stretch it, get it to the other position. So each positions, you do have few exercises. And for the jaw, open, keep it for some time, slowly close it. The muscles are getting activated there. Like how you do for other muscles for your hands and for legs. These muscles also, there are few things that you can do like this for like 15 to 20 minutes a day, which will help you maintain the strength and prolong, like the deterioration will get prolonged.
Good. Thank you. Thanks a lot. And if anyone has any questions want to ask, they can ask. Otherwise, overall, it was a very nice presentation and nice to learn how the swallowing happens, what are the issues with the swallowing, how we can how we can manage those simple issues in a day-to-day basis, or simple exercises can help us how to manage out. This is a good talk by Anjana. Thank you once again. And
Thank you, sir. Thank you so much for giving me the opportunity to
thank you. Thanks.
deliver this.
And thanks for all the attendees who attended this session. And we'll try to upload this on the YouTube for a regular review by others, those who couldn't attend it. Thank you once again.